Hey guys, how's it going? Dr. Krafasi here, and in this video, I'm going to be talking about sciatica, all right? Now, sciatica is super common. There's a couple different reasons why you might be suffering with sciatica though. And so if you've been injured in an accident or any type of injury, again, car accident, work injury, personal injury, you name it, you slip and fell on the ice outside, whatever it might be, sciatica is super common and it's super painful. We've had lots of patients that actually go to the emergency room because the sciatica pain is so painful. So this video is going to go over everything about sciatica. Now, the first thing to know is your sciatic nerve is literally the largest and longest nerve in the body, okay? It is massive. In fact, the diameter of the sciatic nerve is literally bigger than about $50, okay? It's huge. Now, with that being said, any pressure on this nerve, any at all, is going to give you symptoms, okay? Because it's so large, it is so sensitive, okay? So the sciatic nerve will run, okay, down the pelvis into the leg. Now, here's the important part here. There's two main places where you can develop or start to develop sciatica-like pain, okay? Now, the first one is in the level of the spine, okay? And this, because the nerve roots where the sciatic nerve comes out from is L4 to S3, okay? That means it starts at the lumbar fourth and ends at the sacral third, okay? So what happens is all of these nerve roots come out like this and they converge into one big nerve, which is your sciatic nerve, which runs down the body. So the first reason why you can develop sciatica pain is due to usually disc issues in this area, okay? Now this can be caused from other pain, referred pain from an injury, can be caused from things like a facet pain or facet syndrome, which is also common, can be caused from muscle tightness. There's a lot of different reasons. But most important part again is when you have sciatica pain, especially if it is from a disc injury, it's usually going to shoot all the way down past the knee, okay? It's usually a very big determining factor most of the time. If it goes past the knee, okay, this is usually pretty much indicative of a disc herniation. Most often also it can go into your big toe, okay? So one of the digits of the toes is really common as well. So you might say, hey, you know, I feel numbness and tingling in my big toe or my second toe. Really common. Okay, so that first reason again is from a disc issue higher up in the spine. Well, lower in the spine, but higher up. Now the second major reason for sciatica is what's called piriformis syndrome. So your piriformis is a muscle that runs right in the back of your butt region. Now, you have your gluteus maximus, which is your main glute muscle, but you have your piriformis, and your piriformis is a smaller muscle, but it runs kind of perpendicular to a lot of these nerves and the sciatic nerve in particular. Now, this is important because most people sit on a daily basis, okay? We're sitting for hours and hours and hours. Most people don't get a lot of activity. And what happens is this muscle starts to get really tight. And when it gets tight, well, it places pressure on the sciatic nerve because most of the time in majority of the population, the nerve actually sits behind the muscle. Okay, so the muscle's running this way and the nerve is this way. So the muscle, if it gets really tight, starts pushing pressure on that nerve. And what this causes then is, again, shooting pain down the leg. So what might you experience? Again, you might experience numbness, tingling down the leg. If it gets really bad, you might experience some motor loss, okay? Meaning you might not be able to move your toe, okay? That we never want to get that. That's a bad sign, all right? So those are the major reasons for, again, sciatica-like pain. Remember, it's the biggest nerve in the body. It's huge. So any pressure is going to give you pain. So any of our patients that come to our office with sciatica pain, we're giving you exercises. We're going to be working and doing treatment on this area of the body to, one, make sure where the sciatic pain is coming from. Is it coming from a disc area, or is it coming from piriformis, or is it coming from both, which is also common, as well as then making sure that you're getting relief from that. Again, most of the time people will go to the ER for this and they'll just get medication to cover the pain. Usually it doesn't really do much, okay? 9 times out of 10, it's not gonna really fix it. So treatment is really warranted. It's super recommended if you're having that shooting pain down the leg. You can also get, again, referred pain up the back to the buttock region, really all over, because again, remember, this is a hot area for a lot of pain receptors. So that means that not only can it go down the leg or be localized to the butt region, but it can also start referring other areas of the body. So that's sciatica in a nutshell. All right, we're able to do a lot of tests in office to determine, again, what type of sciatica it is and how to treat it even further. So if you're dealing with this, give our office a call today. The office number is listed on this video, and I look forward to helping you soon.